Okay, we were talking about the elbow joint, and this is anterior view. So you're looking at, if you hold your arm out, you're looking at what you're looking at. Yeah, that makes sense. In this view between the humerus, the radius, and the ulna. And then we'll see the other side. And it makes a hinge joint, allows the movement of flexion extension. And again, you see these epicondyle, you see the trochlea of the humerus, and you actually can even see on this picture how that trochlea, the bone looks smoother. That's because that trochlea is going to be covered with articular cartilage simply because a joint is made here. You can see the head of the ulna, the coronoid process of the ulna, and you can also see the head of the radius. Now the radius just stabilizes. The radius makes a joint with the ulna, stabilizes the joint with regard to the elbow. It's really the movement for the elbow is all coming from the interaction between the humerus and the ulna. And then here we have the posterior view where you can really see how that ulna articulates. It then becomes, we always think of the ulna as the smaller bone, but in this particular portion where you have the olecranon fossa is on the humerus, remember, you have the olecranon on the ulna, and it actually makes the joint, and in that area in the head of the ulna, particularly in this picture, it looks like the much larger bone, and in that area it is. So that's the elbow joint, kind of an important joint in terms of what people can have problems with and understanding how those two work together. Those two bones work together to form the joint. Then the radius and the ulna also have a relationship with each other. That head of the radius, when you can see that bone, look at that head of the radius to see what that looks like. That particular disc-shaped head allows for pronation and supination. It's that interaction between the radius and the ulna that allows for the palm of the hand to supinate and pronate. There's also a relationship. It's called a joint, but it's a fibrous joint between the radius and ulna, and it's an it's a membrane. Interosseous membrane. Sorry, I was trying to put an extra syllable in there. Interosseous membrane. It's the two allow for slight movement with this particular membrane, but basically it allows the two forearm bones. So forearm, we can think of the humerus as the arm bone. Sometimes you'll say upper arm bone if you're talking to somebody who's not in your class, who's not studying anatomy, but the forearm, the two together with this interosseous membrane become almost as strong as the humerus. It becomes a very strong bone. However, you know, particularly in children, the ulna is very often broken because as in the shaft of the ulna, it does become very, it is smaller, particularly in kids. In young kids. Distal end of the radius and ulna are going to articulate with the bones that will make up the wrist. We call them carpal bones. At the distal end of the ulna, you have the styloid process, and what that does is stabilize. Anytime you have something sticking out, a process, probably an attachment for a muscle or a ligament, and then you have the styloid process of the radius also, and the notch that allows them to have a relationship with each other, have a joint with each other that doesn't really allow movement, but it does allow some give, I guess I might say, because if there were no give, you would have pain, you'd have friction between the two. Then onto the carpal bones, and I knew I had checked this before, and I knew I was going to get some cut off on the top and the bottom. But all I've done in the top and the bottom when I wrote this out is explain the bones that are in the distal and the proximal, and this is the way generally I notice that people learn them. As they learn them, you learn them whether you're looking anterior or posterior. So when you are tested, make sure it's an anterior view or a posterior, and you're always going to know anterior or posterior based on the relationship of the radius and ulna, and also where the thumb is. So the thumb's always going to be on the lateral aspect, and the thumb is pretty recognizable. But what usually happens is people learn them by the proximal row and the distal row. So the proximal row, and this is based on closest to midline, is going to be the scaphoid, the trapezium, and the trapezoid. Sorry, I said that wrong. The scaphoid, the lunate, the triquetrum, and the pisiform. So those are the proximal bones. And then the distal bones are the trapezium, the trapezoid, and the capitate. The last one is the hamate. And what they are, I mean, the way you can kind of remember them other than to just take your practice pages or take an image and say it over and over and over again, is their relative size to one another, and also where they sit next to each other. These are all considered short bones. Short bones allow for that real subtle movement, not the subtle movement, but the sophisticated finite movement that the hand can do, portion of it, and also you have joints between each of these small bones, so that's where you get this blue color that's showing articular cartilage. So the bones of the wrist are carpals. The bones of the fingers or of the palm are metacarpals, so beyond the carpals, metacarpals. And they are traditionally and correctly numbered with Roman numeral numbers. And so we do number them, but it's always Roman numerals, starting with the thumb, ending with the pinky. So thumb is 1, pinky is 5 in Roman numerals. Thumb has a proximal and distal phalange or phalanx. So the Roman numerals are the metacarpals, and then you have the bones beyond that. Those are the phalanges. Thumb has proximal and distal, and all the other fingers have proximal, middle, and distal phalange. The joint between them are the interphalangeal joint, and you have the distal interphalangeal, the medial interphalangeal, and the proximal interphalangeal joint. Particularly if you're working for, say, a physical therapist who specializes with hand pain, which a lot of people have hand pain, or hand dysfunction, or trying to get somebody to be able to perform activities in a different way than they could before they had, say, a stroke or some sort of problem that shifted how their hands work. So carpal bones, 2 rows. The bones that make up the palm, metacarpals. Bones that make up the fingers, phalanges. And then because you can't see it enough times, here you have the posterior view again. It might be interesting to look at that ulna and radius, how that actually forms joints with the carpals and allows the movement with regard to the wrist, allows part of the movement with regard to the wrist. And then onto the pelvic girdle. As I said, I don't mean to belittle this information. It actually is something that you want to hold in your hand look at, you want to associate terms with where they are, and however you tell yourself that story with regard to how you get that in your head, that's a good thing. But the pelvic girdle, and remember when we think of a girdle, we think of the bones, the soft tissue, and the connective tissue, and also the muscle, so the ligaments, tendons, cartilage. So made up of 2 hip bones, which we also call coaxial bones. They're also called innominate bones. That was the way I learned. I guess maybe that's old school now. And they're very, very strong. Your hip bones are very strong. Every once in a while I'll meet somebody who had a fracture of their hip bones, and it usually, unfortunately, was an extremely serious accident. They're very strong, very unlikely that you will fracture your hip bones. Now, I'm not talking about a hip fracture, but fracture these pelvic girdle bones. Very strong, part of the pelvis. The coaxial bones are made up of 3 fused bones. They're unfused when the baby's born and fused in you, unless there's something amiss. And that is the ilium, sacrum, and pubis. So ilium, ischium, and pubis. I don't know why I keep saying these things wrong. I'm sorry. Ilium, ischium, and pubis. And your PowerPoint is saying that the ilium articulates with the sacrum. I guess maybe that's where that came from for me. But you can see that the top portion of this image, where you have the huge ilium, that's kind of the purpley color. Ischium is kind of the ochre color, and pubis pinkish. And there's also a nice cup in there between it's actually made up of all 3 portions of the coaxial bones, and that's called the acetabulum, and that is where the head of the femur is going to fit into this this coaxial bone and form the joint we call the hip joint. And the hip is the meeting of the point of the ilium, ischium, and pubis, as well as the head of the femur. There are many processes on the coaxial bones, and all of them are for attachments of either ligaments or muscle. So attachments for ligaments or bones. A couple of things that are noteworthy, because you hear of this, and maybe some of you unfortunately have had problems with your sciatic nerve, where you see that sciatic notch. So I'll give you a second to see it on here, the sciatic notch. And what that is a place that actually allows some of the tracking of that nerve. That sciatic nerve is a really big, if you ever get a chance to see it on a cadaver, it's a large nerve. You can see nerves on cadavers, but they look like little pieces of thread. The sciatic nerve is not. You can definitely see it with a naked eye, and you don't even have to be that close. And what happens is, if it gets compromised, meaning you have any inflammation or you have muscles that are out of their size, and that sometimes happens with the piriformis muscle, where it is inflamed, so it's swollen a little, it can push against this nerve. And also, unfortunately, that many times during pregnancy, the baby will not sit against the nerve, but will sit against soft tissue that then pushes against the nerve. And so you have a tremendous amount of pain down the back of the leg. And then if that pain persists, you can also have partial paresthesia, not paralysis, but diminishment of nerve flow. We're going to pick this up on the next one and talk about the hips more.